diagnosis is one of the components of nursing process that is ADOPI, which stands for assessment, nursing diagnosis, outcome identification, planning, implementation, and evaluation. So this nursing diagnosis is the phase where the nurse identifies the patient's health problem. It can be seen as decisions arrived at by the nurse after careful assessment of the patient's health status and responses to illness. It is a combination of signs and symptoms that indicate actual or potential health problem of the patient. So you have to assess the signs and symptoms which the patient presents on admission in order to form your nursing diagnosis. There are 4 types of nursing diagnosis, which are actual nursing diagnosis, risk nursing diagnosis, syndrome nursing diagnosis, possible nursing diagnosis, and health promotion nursing diagnosis. But before we explain the types of nursing diagnosis, let's discuss the components, characteristics, or features of nursing diagnosis. This nursing diagnosis, what does it consist of? The nursing diagnosis consists of 4 features or components, which are label, which is also known as the qualifier or adjective. The second one is definition, which can be also called the human response. We have the related factor, which is also called the cause or the etiology. We have the characteristics, which are the signs and symptoms the patient presents. So the label now describes the patient's health condition. It describes how the patient is responding to the illness. As an adjective or qualifier that qualifies the human response. It shows how the human response is. Example, we have deficits, we have imbalance, excess, etc. The definition is the human response that is the focus of the diagnosis, e.g. fluid, volume, nutrition, etc. The related factor, which is the cause, describe the possible reason for the cause or change in human response. It can be drafted from pathophysiology or from environmental factor. Characteristics is the cluster of signs and symptoms that indicate the presence of a particular diagnostic label, e.g. we have skin gore, weight loss, restlessness, and so on. The difference between actual diagnosis and risk diagnosis is characteristics. The actual diagnosis has characteristics, which is signs and symptoms, whereas risk diagnosis has none. So actual diagnosis now contain 4 components or features of nursing diagnosis, which are definition, label, related factor, and most especially the characteristics, which is the signs and symptoms. Example, deficit fluid volume related to nausea and vomiting, evidenced by skin to gore. While risk factor contain 3 features only, with the exception of characteristics, that is signs and symptoms. There is a clinical judgment that a problem does not exist, but the presence of risk factors indicates that a problem is likely to develop unless the nurse intervenes. So the patient is at risk of having it. No evidence yet, that is the signs and symptoms is not there. So definition, label, and related factors are the components or features of this risk diagnosis. A possible nursing diagnosis are statements describing a suspected problem for which additional data are needed to confirm or rule out the suspected problem. It provides the nurse with the ability to communicate with other nurses that a diagnosis may be present.